Is it possible to feel fabulous after 40 if you are a woman? I'm going to say yes, but there's some things that you need to look at. I'm Dr. Nathan Thompson with The Wellness Way Yorkville, and I recently just did a live video on YouTube. You can go ahead and find it under lives, but I talk about some of the most common things that women are coming into my office with, that being hormone issues or perimenopause, weight gain, fatigue, joint pain, and poor sleep. Now, chances are if you're coming in complaining of those things, you don't need necessarily an oil change. What you need probably is an engine overhaul, but you need to make sure that you're getting things tested correctly. So here are 4 things that I want you to look for if you're over 40 years of age, you're a woman, and you're just not feeling very good. Number 1, your cortisol pattern. Now, cortisol has been demonized quite a bit on social media, but the reality is that cortisol is not a bad hormone. It's not there to destroy you. Cortisol is a needed hormone. It's your get up and go hormone. However, you can have some issues with high amounts of cortisol secretion, or maybe your cortisol rhythm is not in balance. One of the best ways to measure this is to look at a Dutch test, dried urine and total comprehensive hormone. And this can look at the overall cortisol secretion over the course of the day. So if you're secreting a high amount of cortisol, then usually what it means is there's a high amount of mental stress, or maybe there's some issues when it comes to blood sugar regulation. Both of those things can cause a lot of issues with high cortisol secretion. Number 2 is blood sugar, like your A1C and insulin. I have a lot of women who come to me and say, I can't lose weight. And the reality is that they can lose weight. It's just that they're eating way too many processed carbohydrates, or they're just overeating and they have no idea that they're doing it. So generally speaking, how should a person eat? Eat meats and veggies, nuts and seeds, some fruit, little starch, and absolutely no added sugar. Your intake should help you to support your exercise, but not necessarily body fat. And you'd be amazed at how many people say, I can't lose weight, I can't lose weight, I can't lose weight. And you get rid of a lot of the processed carbohydrates, which easily takes down their overall calorie intake, and then they start losing weight. But you should be measuring your average blood sugars over 90 days, which is going to be your A1C, and then also looking at your fasting insulin levels, because if those are both elevated, then chances are you have a problem that you're consuming too many processed carbohydrates. Number 3 is your thyroid dysregulation. I know a lot of people, they want to blame everything on their thyroid, but the reality is there's probably some things that are involved with your lifestyle that are making you not feel very good, and it really might not have anything to do with your thyroid. Really, it can come down to 4 different reasons why it's happening. So number 1, it might be a production issue, a production of thyroid hormone. And this can be related to nutrient levels, chronic stress, chronic inflammation. It also may be a conversion issue in which the liver, which is responsible for 80% of the conversion of T4 into T3, the liver may be having some issues. Number 3, it may be an immune system issue, also known as Hashimoto's, in which it really isn't a thyroid issue. The thyroid is actually responding to a lot of inflammatory triggers that are taking place. And then the last thing is it can be an interference type issue in which there might be certain things that are interfering with the absorption of iodine into the thyroid that are going to interfere with the production of thyroid hormone. This might be certain halides like bromine or fluorine. It can also be an issue with the pituitary tumor, and also it can be an issue with heavy metals like mercury, which is commonly seen in a lot of amalgam fillings that can cause some issues down the road if they happen to start breaking down. And number 4, sex hormone imbalance. So what can cause some imbalances when it comes to your estrogens and your progesterone and things like that? One of the biggest things can be high stress. And remember, you got mental stress, you can have a lot of blood sugar stress that might be taking place. But here's another thing that a lot of people don't look at all that much is elevated beta-glucuronidase, and this is a GI marker. And when you have elevated levels of beta-glucuronidase, what happens is that the liver is removing these hormones from the body, placed within the gastrointestinal system for removal. But as it goes down into the large intestine, elevated levels of this enzyme can actually cause them to uncleave and get reabsorbed and recirculated throughout the body, which can be one of the things associated with estrogen dominance. It can also be with liver conversion issues, such as a fatty liver. And one of the easiest ways in order to get a fatty liver is just overconsume way too much food, and that's why they call it non-alcoholic fatty liver disease. And that can start to influence how well your liver is functioning, especially when it comes to hormone conversion and hormone removal. All right, so you may be saying, what on earth do I need to do, or where do I need to start? Number one, watch the video on YouTube. Then number two, work with a Wellness Way doctor. And the reason why is because they have the ability to do the appropriate testing, give you appropriate plan, work on the appropriate lifestyle changes that you need to make, and then also have the appropriate follow-up to make sure that you're moving in a direction that you need to do so that you can, in fact, feel fabulous after 40. And yes, you are going to have to change your lifestyle. You're not a teaspoon of turmeric away from your health being perfect. It just doesn't work that way. But remember this, start thinking differently. The reason why I say it is you can't solve your problems with the same level of thinking that created the problem. That's why you really do need to start thinking differently and start looking at things from a different perspective. Make sure you go watch the whole video up on YouTube under Lives. And I hope this helps, and I hope this helps you to start feeling fabulous after 40.